wheels on the bus go round and round, round, round and round, round and round. The wheels on the bus go round and round, all around.
United Way donations do work. United Way and the State Department of Health rolled out the Selma Alabama bus today. The traveling medical clinic was manned by 3 residents and a full-time physician who gave a variety of medical help to the underinsured in the area. The bus will run twice a month, and doctors hope to see 20 to 30 patients a day.
The bus program was such a great organic program. It started out of just contact with Dr. Newton, myself, and Kathy Needham, and several others. And in just conversation, this whole program came together, and it was so funny riding to Montgomery to pick out the actual bus, and Dr. Newton writing a grant out on a napkin, and it was just so God-driven that this program became so successful and means so much to so many people. And to have so many folks in this community come together to make it happen just proves that, you know, what this community can do when it decides to pull together.
Hop on the bus, Gus. You don't need to discuss much. Just drop off the key, leave, and get yourself free. Ooh, slip out the back, Jack. Make a new plan, Stan. You don't need to be coy, Roy. You just listen to me. Hop on the bus.
Hi, I'm Dr. Monica Newton. I'm the medical director of the Family Doc and a Bus, and wanted to share with you the key components of our program. We provide patient-centered family care in the typical setting that you would usually expect in the doctor's office, with the lab and x-ray associated with the preventive care and chronic disease management of the common things that we see: hypertension, diabetes, and hyperlipidemia. On top of that, we partner with area churches to provide pastoral care to help not only meet a patient's physical needs, but spiritual and emotional needs as well. The third component of the program is educational. We have community liaisons that are trained to provide education to our patients and act as assistants to them, advocates for them in setting up their appointments with other doctors and explaining how to get involved with the healthcare system. The fourth component is our partnership with HealthLink, and you'll hear more about that from Ms. Kathy Needham, the director.
Hi, I'm Kathy Needham, and I'm the director of HealthLink, the prescription assistance program, and we also have a diabetes monitor program. We've partnered with the Doc and the Bus program from day one, actually since before day one. We recognized, Dr. Newton, Jeff Cothran, and I, that there was a great need in the community, and we tried to figure out how can we best fill this need. The prescription assistance program was already seeing clients that had no insurance, and we were assisting them getting their medication. So when all of the parts of Doc and the Bus came together, HealthLink was able to jump in, and as soon as a doctor wrote a prescription for a client, we were able to help them get that medication.
Hop on the bus, Gus. You don't need to discuss much. Just drop off the key, leave, and get yourself free. Ooh, slip out the back, Jack. Make a new plan, Stan. You don't need to be coy, Roy. You just listen to me. Hop on the bus, Gus. You don't.
Thank the staff for the good job that they're doing today, and really serve me as I need to be served. It's just a blessing.
And I think it's a good program to got in Selma and Dance County, because a lot of folks are out of work and ain't got no job, and the medicine don't cost that much. The average prescription costs $4, and you get most prescriptions be filled at Walmart.
Hi, my name is Patricia Rowe. I've been a part of the Doc on the Bus ever since it started. I feel it's a great help for those that don't have insurance through their jobs, and it's just been a tremendous help for me, and it's keeping me very healthy.
You don't need to be coy, Roy. Just get yourself free. Hop on the bus, Gus. You don't need to discuss much. Just drop off the key, leave, and get yourself free. Ooh, slip out.
One of our vital partners that came in about our one-year anniversary were the Fathers of St. Edmund. They were able to give us the permanent location that we're at now. So we transitioned from the trailer to a permanent location, and thanks to a great partnership with the Fathers.
My name is Aretha, and what made me come to the dock on the bus that at the present time I was out of work and I decided to make a call to the United Way to get a checkup on my high blood pressure, cholesterol, and diabetes. And I thank God for it because a lot of people now, unfortunately, and we're blessed to have it to help other people that's in need and wants. And thank God for more people to attend it and come to the service. That's all I have to say.
You don't need to be coy, Roy. Just get yourself free. Or hop on the bus, Gus. You don't need to discuss much. Just drop off the key.
My name is Rhonda Abbott, and I'm the Interim Director for Emergency Management in Dallas County. And I think the Dock and the Bus program has been so successful in our communities as far as reaching out to people who is not insured. And the Dock and the Bus program is going to be here to provide for our community in the event of a disaster. Dock and the Bus can be mobile enough to go into other counties as well as into Dallas County to remote areas and service our citizens when indeed there is a disaster. I'm thankful that Dr. Newton has put a lot of time and effort into Dock and the Bus to make it work, and I'm thankful for grant funding through public health and the Governor's Office of Community and Faith-Based Initiatives to continue to keep this program in Dallas County.
You don't need to be coy, Roy. Just get yourself free. Or hop on the bus, Gus. You don't need to discuss much. Just drop off the key, leave, and get yourself free. Ooh, slip out the back, Jack. Make a new plan, Stan. You don't need to be coy, Roy. You just listen to me.
My name is Princess Ann Smith. I live in Selma, and I worked at the cigar factory here for 9 years. It closed, and that left me with no insurance and no way to get my medicine. This has been a lifesaver for me. The people are nice. Without my medicine, it would be hard to live from day to day.
In real terms, when you're looking at programs, we look at how much it costs to put on a program or to operate it, and what is our return to the community on the investment. And with the Dock and a Bus program, we're seeing a 4 to 5 to 1 return in real dollars for medical services for the money that we get in through grants and other operations. But the one value we cannot put on this entire program is the peace of mind our patients and our clients get when they come out of a clinic and they now have an idea about how to live a healthier life, about how to manage their diabetes or their high blood pressure. To the price and the return you see on their faces when they leave there with a smile and having been comforted and have been taken care of, that's a priceless return on investment that you can't measure.
Wheels on the bus go round and round, round, round and round, round and round. The wheels on the bus go round and round, all around the town. So check 'em out, check 'em out, check 'em out. So check 'em out, check my wheels out, ma. The bell rings and I run out.